The heart is a precious thing, and heart health is something we should all take pretty seriously. According to the American Heart Association, the AHA, close to half of the population of the US have some kind of heart disease. That's a huge number. Heart disease is currently the leading cause of death in the United States. Blood tests are the main way to get accurate information about your heart health. So, if there was a way to predict if your heart health was going to take a dive, that would be great, right? Well, researchers might have found one. Before we get into all things heart-related, we would love if you hit that subscribe button and click the notification bell too, so you never miss out on our daily videos. In this video, we're going to discuss this amazing new blood test that can predict possible complications in heart health, but also the ways in which you can keep your heart healthy and strong. As we've already pointed out, heart disease is the #1 killer in the United States. So knowing when to listen to your heart and how to take care of it should be top of mind. The blood test we're going to talk about may sound like a magical test, but recently researchers have discovered this test that could possibly predict your future heart health, predicting the possibility of having a heart attack or stroke years in advance, even if you currently have no signs of cardiovascular disease. It's called the High Sensitivity Troponin I test. Just like in the name, this test is more sensitive to certain enzymes in your heart, called troponins. These enzymes are produced when your heart becomes damaged. Healthcare professionals use tests like this one to identify if someone is having a heart attack while experiencing chest pain. Hospitals in Sweden have been ahead of the game for a few years now, using this new blood test. Turns out it's about 10 times more accurate than the original troponin test, used in most hospitals in the US. This newer, highly sensitive test can discover heart attacks much earlier, and they can be treated much faster. Researchers were quite surprised when they were studying this new, more sensitive blood test. Studies showed that after the patient's first heart attack, if they were treated with this new highly sensitive blood test, their risk of heart attack in the future had decreased. Dr. Holtzman, who is the leader of this study and an associate professor of epidemiology in Sweden, said, "We didn't think that the more sensitive test would affect the risk of future heart attacks." With this new information, Dr. Holtzman supports this new test and believes that more hospitals should start using it in the way they treat heart attacks. Further research with a new study conducted showed this new blood test revealed that the High Sensitivity Troponin I test could actually predict future heart issues and cardiovascular events in healthy folks of middle age or older. Because this test is up to 10 times more sensitive than previous blood tests of the past, it has the ability to warn a potential patient of many different types of issues that cause high troponin levels. However, there are many possibilities when it comes to heart complications, whether it be clogged arteries, high blood pressure, or something else. So what exact cardiac events can this test detect that could suggest high troponin levels? Well, this test can predict issues such as stroke, coronary heart disease, heart attacks, and even heart failure. So far, this new blood test sounds pretty amazing, especially if you or someone you love has a history of heart-related issues. Having something that can predict how your heart will behave in the future has helped many change their bad habits and adopt heart-conscious ways of living in order to minimize the risk. Although more information needs to be researched, the outcomes thus far seem pretty positive. Heart disease is something that affects almost half the population in the United States. So doing your part to live a clean and healthy life can really make an impact when it comes to your heart. Unfortunately, some of the risk factors are out of our control, like age and a history of heart disease. But knowing the risks means you can take necessary precautions to keep your heart healthy for as long as possible. Here are some of the things that you can control that would normally put you at risk of heart disease. Smoking. In case you needed another reason to kick the habit, smoking will put you at a much higher risk of heart disease than non-smokers. Not only that, but smoking is not only bad for your health in general, but those around you. Being exposed to secondhand smoke can also increase the risk of heart disease, not to mention the obvious damage it does to your lungs and how hard it can be to quit. If you've been thinking of ditching the habit, the benefits and how great you'll feel might surprise you. Alcohol. Ah, yes. Bad habits like smoking and drinking are something that pop up often when talking about a person's overall health. As time goes on, studies are showing the true effects booze can have on not only your heart health, but the body in general, and they're not great. We have another video on the Bestie channel all about the effects of drinking on your body. But to sum it up, the National Institute on Alcohol Abuse and Alcoholism says men should stick to no more than 2 drinks per day, while women should not surpass 1. High cholesterol. Managing your cholesterol has a lot to do with your diet and exercise. The more healthy your lifestyle, the less bad cholesterol, or LDL cholesterol, will be in your system. Things like saturated fats and trans fats can raise this bad cholesterol. So eating healthy, aka lots of veggies, and getting enough exercise can do you a world of good. In the long run, your heart will thank you. High blood pressure. Having high blood pressure means your heart is working overtime with no pay increase. It can also cause your heart to stiffen up and not function as smoothly as it should, which could then open the Pandora's box filled with many other heart-related issues. Stress. We've talked about the many ways you can reduce stress on this channel. Make sure you check out the mental health and anxiety playlist on our channel. Stress is something that can negatively impact our minds and bodies in so many ways. Unfortunately, life is full of stressful things, but there are healthy ways of handling these stressful moments out there, like meditation, exercise, and positive lifestyle changes. Diet and exercise. You knew this was coming, didn't you? Eating right and staying active are 2 great ways to help reduce your risk of cardiovascular disease. Try to stay away from foods that are processed and have empty calories. Make sure your diet consists of whole foods that are full of nutrients, vitamins, and minerals your body needs. A heart-conscious diet could consist of things like fish, lots of veggies, nuts, and legumes. Also limiting your intake of red meats and sugary stuff. The world of medicine is advancing each and every day. This blood test is just another amazing step forward. Even though new discoveries are being made every day in the medical world, you can still help out your heart each and every day by applying some of those tips we just listed. Did you enjoy this video? Are you someone who's very heart conscious? Did you know about this amazing blood test before you saw this video? What are some heart-friendly habits you stick to in your daily routine? Why not let us know in the comment section below all the ways you love your heart. Enjoyed this video? Hit like, share, and subscribe to Curiosity. Wait, why not fulfill your curiosity by watching these other awesome videos? Go ahead, choose the left or the right video and enjoy.